Hi, this is Paul Barr for Hospitals and Health Networks magazine. I'm here today with Dr. Shireen Gabriel, Dean of Mayo Medical School. Dr. Gabriel, who is a rheumatologist, is here to talk about a project Mayo is working on to try to transform medical education. Mayo is a recipient of a $1 million 5-year grant from the American Medical Association as part of a total $11 million grant program. Thank you for being here today.
You're welcome. It's my pleasure.
Why is there a need for this AMA grant program in general?
I think there's a recognition that as healthcare is evolving so rapidly, it's important that our undergraduate medical education and medical education in general, in fact, evolve to keep up. And as dean of a major medical school, we have a unique opportunity, a responsibility really, to transform our medical education programs so that that next generation of physicians and physician scientists can effectively address the challenges of our rapidly evolving healthcare system.
And what is your project in particular going to try to do?
When you look at the current medical school education programs today, they suffer from a number of challenges, a number of problems. They're isolated, first of all. We've each of the 140 some medical schools developed their own programs in biochemistry and anatomy and so on. And that, when you look at it, seems quite inefficient. They are didactic. We still have a lot of lecture-based content. They're focused on learning about diseases and treatments of diseases, important, but probably not enough anymore, and they're costly. What we and other medical schools in this AMA consortium, and frankly outside the AMA consortium, are working towards are programs that are much more collaborative, that involve bringing in expertise and knowledge from other institutions to help make our training programs and their training programs better. So how do we learn from others? How do we share what we have and teach others? They're much more innovative than the first generation, than previous medical school education program. And by that I mean we're bringing to bear education informatics, education technology tools in ways that medical schools have not done in the past. Online learning, blended classrooms, flipped classrooms, that kind of thing. And so that's also part of our education program, that's also part of what how we're responding, how Mayo Clinic is responding. And we're bringing new disciplines into medical education, disciplines that have not traditionally been part of medical education. At Mayo Clinic, we have something called the Center for the Science of Healthcare Delivery. We have honed patient-centered, high-value healthcare delivery at Mayo for the last 150 years, and we're now developing major programs on how to study that, how to teach that, and how to ensure that the next generation of physicians and physician scientists know how to deliver healthcare in the most efficient and the highest value ways. And that means bringing new disciplines into medical education, disciplines like health economics, health systems engineering, health law, and so on. And so that's another innovation. And finally, it's important that we do all of that. It's important that we do all of that at a higher value to the students, at less cost to the students. And through through use of technology and through our collaborations, we can do that and do it at a lower cost to our institution and to our students.
How many of the students will be involved in the project?
Well, we believe that the science of healthcare delivery is such a fundamental body of knowledge that is going to be required for this next generation, that there's some foundational knowledge in that content that every student is going to be required to master. And so the foundational elements of the science of healthcare delivery will be part of our required curriculum for everybody. Now, in addition to that, we will have an option for students, interested students, to pursue a master's degree in healthcare delivery sciences, which will be either integrated into the curriculum or they could take a year out and pursue that master's degree.
You've talked a bit about how things are going to be different. What do you envision staying the same in terms of medical education?
Well, I think it's important as we consider all of these changes that we don't kind of throw the baby out with the bathwater. There are some unique elements of medical education that need not only be preserved, but enhanced. So all of us who trained in medicine know that we've learned the most with and from our patients. So the time spent with a patient, the patient-centered care, I think must continue to be the center place of our teaching. So patient-centered care, time with patients, working in teams, interprofessional team learning and interprofessional team care will be preserved and enhanced in our model. And finally, one-on-one learning, a teacher and a student, or small group, highly interactive learning with seasoned faculty, experienced faculty is something that we're also going to enhance in this model.
Do you expect medical education to continue to change over time, or do you see this reaching a point where it can be fairly stable?
I guess a little bit of both. I think we're at a time point where substantial change is needed in the areas that I mentioned. And once those substantial changes have been made, it will be a little bit more of an evolutionary change over time. So as we bring new technology to bear in our educational programs, there's always better and more sophisticated technology that we can use, and we'll be continually looking at that. As we think about new disciplines to include, again, those will be revised and refined over time. But so there will be some evolution over time, but over the coming probably 5 to 10 years, I think we'll see major changes.
Well, thank you for being with us today.
You're very welcome.
This is Paul Barr with Hospitals and Health Networks Magazine. Thank you for watching.